what the next steps are, it really is dependent on what we call the stage of the tumor. How advanced is it? How far has it gotten? How deep is it?
I did a routine blood test, I believe it was back in June. He did the endoscopy, and he found something in my esophagus that was cancerous.
Time is of the essence. As the weeks and months go by, the tumor continues to double, and then once it penetrates into the muscle and through it and out to the lymph nodes, that's when the chance of survival really goes down.
He did a drawing and explained how the tumor, as long as it's only attached to the inner wall of the esophagus, he would be able to take it out. He said right away,
we're going to get this
"I'm
taken
going to get
care
this
of."
right now."
There are not many skilled physicians who can actually do this procedure. So 3 hurdles. Is it removable? Can I remove it? And did the pathologist tell us we got it all? I just ask for your presence today as we care for Mr. Letterman. Direct my eyes and my mind to see what I need to see to be able to remove the entire cancer in one piece and to spare Mr. Letterman and to give him possibility of a cure.
It was a long 6.5 hours. It's going to be okay. I felt very confident in Dr. Chang, but I also was concerned about my husband.
Dissecting, muscles below. Yeah, just a spray, yeah. I'll know within 20, 30 minutes if it's resectable or not. And now I'm going...
Hello? Everything is pretty good. He's just keeping busy.
Monday was the golf tournament, and Monday evening was the phone call from Dr. Chang.
How are you doing, sir? The pathologists have determined that the cancer, although invasive, has been completely removed. Nothing else needs to be done. No chemo, no radiation. This is a curative resection.
Dad, cheers to your health. We're so happy that everything went well. We love you. We love you.
Love you.
Seriously, we requested alcohol.
Oh my goodness. I love you.
Hi, Papa.
Yeah, amazing. It is amazing.
I don't think I've ever had more confidence in a doctor than I did with Dr. Chang.
When it was over, it was just a relief. I happen to like him. Yeah, after 54 years.
My life has been extended. Because of Dr. Chang, I'm cancer-free.
We just watched an amazing video about Rick Letterman, and we want to joining us today is Dr. Ken Chang from Hoag's Digestive Health Institute. He's going to share some of the groundbreaking advancements in digestive care and a remarkable patient success story. And thank you so much for joining us. That was an amazing video that you guys put together, and really told us an incredible story.
Yes, thank you for joining us, Dr. Chang.
You're very welcome.
We would love to get into this story, but first we want to hear just a little bit about you.
Yeah, I'm a gastroenterologist focused on cancer treatment, diagnosis. I've been in the academic world for close to 40 years, published over 450 papers, different techniques of detecting, finding, treating cancers in different stages and pre-cancer. Most recently, I've joined Hoag, and that's where I had the opportunity and the honor of treating Rick Letterman.
Now, Rick was, you're 3 weeks in, and this is one of your first patients you have, and you have this really a major development here with this cancer, and you just happen to be one of the only people who can perform the surgery successfully. Did everything just mesh up perfectly for him? Yeah,
Rick was a true convergence story, and even as I was taking care of him, I couldn't help but self-reflect that these 30, 40 years of training and experience all converged on Rick to help him as a true success story.
It's truly a miracle.
Yeah. So, Rick had chronic acid reflux, something that 20% of our adult population suffer from, and it's considered a nuisance thing. Take Tums or PPIs, but that was treated, but not fixing the anatomy, which is something that I advocate for. Fix the anatomy as opposed to take medicines or mask the symptoms.
Right.
Then he went on to develop Barrett's, which is pre-cancer, and then he went on to develop the invasive cancer. So he went through the entire spectrum from GERD to Barrett's to cancer.
Wow.
When I saw him, literally I get a text from the referring physician on a Friday. I got him into clinic on a Monday, and I did his procedure on a Tuesday because I knew how important timing was. And when I sat down with Rick, as you saw in the video, I said, look, Rick and Glorianne, his lovely wife, we've got 3 hurdles in front of us. The first hurdle, because the tumor is large, it was 4 centimeters, it was already invasive, he was already having trouble swallowing. The first hurdle is it possible for me with a thin scope the size of my pinky to go down into your esophagus and carve this whole thing out, make sure the outside margins are clean, and get even the deep margins.
Right.
So that was the first hurdle. The second hurdle was to see if there's any signs of progression outside of the esophagus. So I did do endoscopic ultrasound. I saw a couple of lymph nodes, and it wasn't certain whether they were benign or already cancer spread to them. So one of the things that I developed a while back was the ability of using endoscopic ultrasound, pass a tiny little needle through the esophagus, biopsy the lymph node, and know on the spot whether it's benign or malignant.
That's incredible.
So I did that, and within minutes, the cytologist said, there's no cancer, they're just benign lymph nodes. And then I went on to do the resection, which took several hours. But then the next hurdle was, that he would recover safely, which he did. And then the final hurdle was the pathologist telling us that we got it all, and that the margins were negative. And so each of those hurdles he was able to achieve, or we were able to achieve together, and he's cancer-free after 14 days.
Well, the real final hurdle is making sure he got to the golf tournament.
Exactly, because the day I called him with the good news that the tumor board had deliberated, and they said, look, we don't see this, but the endoscopic resection resulted in a curative resection. No need for chemo, no need for radiation, no need for surgery. He is cancer-free. So when I called the home, Glorianne picked up, and Rick had just walked in. And when I got him on the phone, I said, how's your day going? He goes, great. I played golf and I won the tournament. And I said, well, I can top that. And this is the result from the tumor board. We got it all, the cancer's out and you're cancer-free.
What a wonderful feeling.
Yeah, absolutely.
So, Dr. Chang, how quickly do you believe it grew from nothing or 1 to 4 centimeters?
Yeah. So he had GERD for over 20, 30 years.
And that's something that's on the rise, is that correct?
GERD is on the rise, and that has to do with the way we eat and how we eat and how much we eat and how we eat and go to bed. So GERD is on the rise. Precancerous Barrett's is on the rise. And the final landing spot is invasive cancer, adenocarcinoma. And that has risen almost tenfold in the last 30, 40 years. While all other cancers are flat or decreasing, esophageal cancer is rising. And that's because of the Barrett's and the GERD. Yeah.
And his tumor was so fast growing, you knew you had to get it out within days, right? I mean, it's not something that could wait.
Not something, you know, whether, if weeks had passed, then already the result showed that the cancer had gone pretty deep. It was getting very close to the muscle. I was able to carve and shave all the way down to the muscle, but the amount of margin I had was less than 2 millimeters.
Wow.
That was it. If a few weeks later, it may have gone through those 2 millimeters into the muscle, and now we're talking about esophagectomy, which is a big operation.
Life-changing.
Life-changing, yeah.
Well, what is Hoag doing to prevent people like Rick from ever having this happen in the first place in terms of treatment for GERD?
Yeah. So based on just Rick's paradigm and story, what I've been passionate about and dreaming about is to create a esophageal cancer-free Orange County. So I feel that we are responsible for the 3.5 million people who live in our community. And this is an achievable goal. If we can get the folks who should be screened, who have chronic acid reflux, and find Barrett's, we can keep them on surveillance, or we can get rid of the Barrett's. One of the technologies named Chang that we now use routinely to ablate the Barrett's tissue and reverse it back to normal. We can apply that. So if we catch Barrett's, we can either keep them on surveillance, risk stratify them to know which folks should get treated. We can get rid of the Barrett's and prevent it from ever going on to cancer. If they slip through the cracks and get early cancer, we can do what we did with Rick. But he was at the very last,
He was at the end of early.
He was a hairline away from too late. And obviously, then if they need an esophagectomy, we have minimally invasive surgeons who can do that. And then we get into the oncology, chemo, and so on. So from a population point of view, how do we achieve a cancer-free Orange County esophageal? We create a screening program where you don't even have to have an endoscopy. You swallow a little capsule that's tethered. You pull the capsule out it's a 3-minute exam. Those cells collected get sent off for genetic DNA testing. And we can separate those who will never have cancer Barrett's or those who have cancer and Barrett's today who should be screened. If we employ this kind of a strategy, we can potentially achieve an esophageal cancer-free Orange County. The same paradigm is true for colon cancer. So colon cancer, we know, is the #2 cause of cancer deaths in our country. The vast majority, 95+% of colon cancer come from colon polyps. We can find these polyps, we can take them out before they ever get to cancer. So we can eliminate colon cancer if we work at a community level, right? Awareness, leveraging AI for detection of polyps, taking them out early, and ever preventing the cancer from happening. That same paradigm for liver. So liver cancer and cirrhosis and the need for liver transplant is a huge burden for the health of our community. And especially amongst our Asian community, liver cancer and stomach cancer are disproportionately high. Well, how do you get to end-stage liver disease and liver cancer? It used to be it was all hepatitis, hepatitis B and C. Now fatty liver is overcoming hepatitis as the number one reason people get cirrhosis and need a liver transplant. So we're creating a program that detects fatty liver earlier, intervenes earlier, risk assess, and reverse it with more intentional weight loss programs such as endoscopic bariatric procedures, and stop this downhill slide towards end-stage liver disease and liver cancer.
How much of all of this has to do with the lifestyle, what we eat, what we're doing? Is there getting ahead of this also start with the prevention or getting people on the right path?
Absolutely. So we're looking at all of the risk factors. A lot of the risk factors are within our control, right? Whether we smoke or not, alcohol, weight, and diabetes, all of those risk factors that we know about. We're taking a comprehensive approach to help patients hit all of those different risk factors to reduce them as much as possible. The way we eat does factor in. For example, in the GERD story, studies have shown that a lot of people focus on what we eat, but as important, maybe even more important, is how we eat. The same amount of stuff that you eat, if you eat it slowly in small portions, distribute it through the day, and avoid eating close to bed, is going to be much healthier than 2 or 3 huge meals, with the last one being close to bedtime.
Okay.
Yeah.
Yeah, they always say sort of taper off your meal by about 7 o'clock.
Exactly.
Would you concur with that?
Absolutely, because think about it, if you load the stomach with food, you're eliciting a huge acid rush into the stomach. And then you go lie down, and if your valve is loose between the esophagus and stomach, you're going to reflux all that into your esophagus through the night.
That makes sense. And so you have a clinic that's just 8 minutes away, is that correct? Over in Lisa Viejo?
Correct. So 15 minutes north of here, we have our new Irvine Hospital campus with a gorgeous new Digestive Health Institute that will open up in about a year. But there's a hospital in Irvine, as well as obviously our Newport Hospital. But Lisa Viejo, which is only 15 minutes from here. No, Lisa Viejo is only like 5 minutes from here.
We can almost walk.
Yeah, you can almost walk. We have a health center there, and in May we'll have 5 of our digestive health faculty at that location. So we'll be very close.
What's the overall goal? I mean, you're talking about cancer-free Orange County in terms of these areas. What has to happen between now and that goal line that you've set for yourself?
Yeah, so we're looking at launching these centers of excellence and recruiting world-class talent to come and help lead and populate these centers of excellence. So for example, our foregut and heartburn center, which is Rick's story, I'm recruiting the best of the best on the surgical side and on the GI side, diagnostic side. And Hoag is launching a digital campaign that'll create an app that if you have heartburn, you get on the app or you get online and they'll ask you some questions and it'll interact with you. And most importantly, it'll help you navigate who should see a doctor sooner than later and who can wait and modify this and modify that. And it actually checks up on you. So those are some of the community level activities we will have with these centers. A second center is our weight and metabolic center. We know that obesity is the other pandemic, right? With COVID behind us, obesity is killing our community. Heart attack, stroke, cancer risk. And by the year 2050, more than half of our population will be considered obese. Wow. BMI greater than 30. And all of the downstream complications health-wise that represents. So we're doing a full-scale attack on weight management and diabetes with this new center. So folks will come and they'll have a comprehensive approach, dietitians, nurses, nurse practitioners, exercise physiologists, medications, GLP-1s, surgery if they need it, but endoscopic approaches to tighten the stomach and people can lose weight. And it's a combination of all of the above that'll get people to the right healthy weight and also treat their metabolic diabetes. So that's our goal, to be able to make an impact to the health of our community with centers like this.
We just have about a minute left. Is part of the vision that Hoag has is what brought you here in the first place 8 months ago?
Great question. So these dreams for Orange County have been there for a long time. And when I took a look at Hoag and I understood the engine and the driving force for Hoag's existence and Hoag's tremendous growth is loving and caring the community of Orange County. And when I understood that and the dreams and aspirations I had for our community, I felt that I could move the needle faster in this environment to impact more of our community than I ever could before. And that was really what attracted me to come.
Well, Dr. Ken Chang from Hoag Digestive Health Institute, thank you for coming here. Thank you for sharing your story, Rick's story, and your vision for Hoag here in Orange County.
Thank you very much.
Thank you.
Thank you.
You're watching This Day. We'll be right back.